Good afternoon. It's Tuesday, September 13th. This is the Wisconsin Rapids Human Resource Committee. All members are in attendance except for Alderman Rayom. A list of others in attendance will be on file in the clerk's office. We'll call the meeting to order at 1:33. And with that, we'll go to number 2, an HR update. First item is Speak Your Piece presentation. Second is Recruitment and update. And third is the Safety Committee. And with that, I'll turn it over to Mr. Hartman.
Thank you, Chairman Bemke. A couple quick updates and things that we've been doing in the HR department and the city overall. Back on August 24th, I belong to part of a HR roundtable group, so all HR professionals from around the surrounding area are invited to come every other month to just kind of a Q&A amongst our cohorts in the HR profession. So we discuss hot topics, current trends, that type of thing. We also had the opportunity on August 24th to have a Speak Your Piece presentation done, and we were hosting that. So we decided to offer it to the supervisory leadership individuals that went to the trainings in the spring that the council had approved for the Michael Best training. So we had overall, I believe we had close to 40 people in attendance. The presenters of the Speak Your Piece program were Kim Brubaker from Renaissance and Kurt Hoyer, the former police chief. The feedback I received was that it was worthwhile. My understanding is the Speak Your Piece project is something that the council went through years ago. I'm not sure if Alderman Rayom remembers that or not, but I think you might be the only one on the council currently that might remember that. But they're still doing it, and we had it on August 24th, and I think a couple people in the audience, individuals in the audience attended. Moving on to the recruitment update. Currently, we are still in the process of looking for a police chief. That application deadline is September 15th, as I believe is the common laborer for the street department, and then the constant need for crossing guards. And we are in the final stages of filling police officer positions and IT intern. Lastly, any questions on that topic, or I'll move on to letter C, the Safety Committee. After some time away, the Safety Committee has re-adjourned, had that meeting earlier today. Ben Goodrow is in the audience now. He was part of the committee that met earlier today. We talked on very broad brush topics, looking at revamping the policy, but again, just essentially ways to protect the city's most valuable pieces, which is obviously our employees. And some topics today were, OSHA training and updates, CPR certifications, maybe revisiting violence in the workplace, active shooter type scenarios, and then by department, some power line, maybe working together a little bit more closely with water and light, and some power line training for those personnel who could deem that necessary during their work days. So that is my updates on those 3 items. Any questions?
You speak about the power line training. Have you talked to them at all about burying the power lines within the city so that we could get rid of that risk?
I have not talked. You're referring to if I've talked to Water and Light about burying the power line?
Yes.
No, I have not. Literally, the meeting was at 11 o'clock today. At 11 o'clock today, and I just reached out to Water and Light to see if our contact over there would be interested in helping us out and teaching us, some of the schematics around the city of power lines and what we need to be on the lookout for. Pursuant to police department, fire department, street department, not so much the HR department, but those other departments that are out on the streets.
Okay,
I can probably
Yeah.
add a little something to that. I can tell you, as you're talking about budgets, I think each year they budget to do some improvements, and underground is one of those things. So, like everything else, it's very expensive, and they're doing it as they can. So, yep. Anybody else have anything? Tom, Dennis? All right, we'll move on to item number 3 then. Discuss and consider for approval the addition of 6 new firefighter positions, with 3 of the positions contingent upon an award of a SAFER grant, and for the 3 positions, the grant will pay for 3 positions for 3 years, and the city can reapply for the grant after 3 years. Chief, you want to start us out?
Sure, I got just a little extra documentation for you here. So the first one, the top single page that I gave you, there were some questions when we were here in front of your committee about run times. That is a query from January 1 until August 31st. So you can see that although we spend a little extra time to that south, in many instances it's no more than 10 extra minutes per call. And it kind of aligns with what happens on a call. What we do for a patient doesn't change one bit, whether it's in the town of Port or the village of Buren or the city of Wisconsin Rapids. It's the transport time. So that 5 minutes, that 6 minutes it gets to that patient and back, that's the difference in those calls. So really our time that we're spending out of the city is not that much more than what we spend in the city for our patients. Any questions on that one?
I have a question.
Yep.
So, I know what we've done with the towns, villages, and surrounding communities that we've signed contracts with. Do we have a contract with the Ho-Chunk Nation?
We do. Actually, the Ho-Chunk Nation, or Ho-Chunks is a sovereign nation that lies within the town of Port Edwards. We do have a contract with them. They actually are very generous with what they're giving us for their nation because what they're taking is their average population in the casino, and that's what they're paying per capita. That was an agreement between them and the city as far as their per capita charge. So we do have a contract with them.
Very good, thank you.
And the other ones that you see there, when you see like Armenia, Rome, and Big Flats, those are mutual aid calls to the ambulance services down there. We have mutual aid contracts, and we have to by statute. And we also have mutual aid with United. We rely on them just as much as they rely on us. So, matter of fact, in September we have a mental health training with our members, and Camp Douglas and Lifestar out of Rome are actually bringing ambulances up and set them in the city so our on-duty people can make that training and not get disturbed during it.
I have another question.
Yep,
So you said we're obligated by state law?
state statute to have mutual aid contracts.
How are we selected as the ones that provide the mutual aid?
For them,
Correct.
it's usually who's your closest bordering ambulance service. So we are the closest bordering Lifestar, Camp Douglas into their areas, United into their areas. We also have mutual aid contracts with Stevens Point if we need them, but
There's nobody closer to Camp Douglas than Rapids?
I'm sure they have contracts with people to the south of them, but our area that we pick up with the town of Port borders their area coming up from the south.
Okay.
So they have them also with just like Lifestar has them with Waushara County. I can tell you that Waushara County gets called for mutual aid much more than we do down into the Lifestar's area, down into the town of Rome, Big Flats.
Okay, thank you. Any other questions?
Okay, that second report I just gave you, I wanted you to see exactly how much. Those are overlapping calls, again, from January 1 until 8/31. And you can look through that. This query goes from time in service of the first ambulance till the next ambulance is back in service. So when you see 3 in a row, such as Group 1 there, that means that there was 3 ambulances out all at one time, or 3 pieces of apparatus. It doesn't have to be an ambulance. It could have been the engine. It could have been, rescue at a car accident or something like that. So when you see all of these, that is every time that 1, 2, 3, or 4 ambulances are out. Just going through this and using the query system through that period, there's only 43% of the time that they were single dispatches. So 56.5% of the time we got paged out from January 1 through August 31st. There was already a piece of apparatus or 3 pieces of apparatus or 2 out when that ambulance or that truck or that rescue got paged out. And this is why I wanted to show you this, is how it aligns to just what we're talking about with the percentage of time that we're sitting at fire stations with less than what we should have for staffing. Just an example, yesterday, this was just yesterday, 10:29 in the morning, paged out, 10:31 paged out, 2 ambulances out. Our minimum staffing is 9 people. You put 2 ambulances out, that's 4 people out of there. That means they're sitting at the station with 5, in the city with 5. At 14:41, so 2:41 in the afternoon, paged out. 3:06 paged out. 3:09 paged out. 3:22 paged out. 3:39 paged out with fire tones. If it wouldn't have been the daytime, and Justin Pluis, Division Chief of Fire, and myself were there, our battalion chief would have been sitting there by himself at 3:39 in the afternoon with fire tones going off. Luckily, this was an odor, but hydrogen sulfide type of odor, rotten eggs, people are evacuating the building, that can be just as detrimental as a fire can. They weren't even cleared out with that, and at 4 o'clock, they got called in a motor vehicle crash on 2nd Avenue and the Expressway. We're trying to scramble to get 2 people down there just for that. This happens on a lot, I don't want to say daily basis, but very often. And you can see that in that report I ran for you of overlapping calls. 56% of the time in that 8 months, we already had a piece of apparatus or 2 or 3 out. So this is the crux or the importance of why we're asking for these firefighters. So the other one is the overtime. Right now, our minimum staffing, 9 personnel. If the battalion chief takes off, we're hiring back. If we get 2 more people, our minimum staffing will still be 9, but with 2 people off on vacation, we'd have 11 on every shift. Battalion chief takes off, nobody gets hired back. We still got 10 people. Somebody even calls in sick, nobody gets hired back. We still have 9 people. The overtime situation is going to reduce greatly. I just checked just before I came here, from if we would have had a 12th person instead of 11 on a crew, we're already at $99,000 of overtime that could have been saved by a 12th person. We've been tracking since January 1, every time that we had to hire somebody back, that a 12th person would have made a difference in that or would have changed that hire back. And we're at about $99,000 right now. So there's a financial aspect that can improve this. Tim, I know, was working on 2 different budgets, the budget with status quo and a budget with 3 more firefighters and a budget with 6. He actually asked me what I thought our original budget could be cut back. I think if we had 2 more firefighters, our original budget in a year is somewhere around $140,000, $138,000. That's our original overtime budget. I think we could almost cut $80,000 or more off of that on top of that. So if you look at the $90,000, $99,000 we'd have saved in that $80,000 with 2 firefighters extra, about $60,000 or $50,000 with 1 firefighter, there's a savings there also, and I think Tim will agree with that. We've already discussed this. And I still go back to the money that was allocated through the increase on user fees and the contracts, and between all of that, the money, I truly believe the money is there for us to be able to put 3 firefighters on at the beginning of the year. This risk and liability that we're placing on not just the citizens of this city, but also our members. Just place yourself in what that battalion chief would have been like at 3 o'clock in the morning, the only person left in the station, and a fire tone comes in. I've been there with 3 people and showed up with the only person with the fire engine. It's not a good feeling. We're putting a lot of stress on the guys and the gals that are working here, that are those 2 or 3 people that are left. We always try to hire back to 5 because we can make at least an attack or a rescue at 5, but sometimes we can't get people back. You know, they're getting beat up while they're here, and it's hard to get them back because they finally got some time off. So there's a lot of reasons why we need these extra 2 people on each shift, the extra 6. We're more than willing to be financially, you know, responsible by doing a safer grant for 3 of them, but come January 1, we need 3. And as long as the money's there, which I believe it is, we feel that it's justified. I know Ben has been talking about this for a long time. He's put together his thoughts, and if you would like to hear him, I would let him speak also.
Anybody have any questions of the chief? For me? Go ahead.
Go ahead.
Okay. How did you come up with the number of 6 added employees, and is that going to be enough to cover you for the foreseeable future? Like how long will this 6 last before we have to add on more going at our current rate? Is 6 enough?
So I come to the 6 is we're sitting at 11, all right? So full staff, 2 more would be 13. NFPA 1710 says we should have 15. Now, I think I explained to you in our first one, we've done a lot of things to try to work around those extra 2 people by, we don't have a RIT team or a rapid intervention team that's supposed to be on scene with every fire. We've trained our members to be, the next team up is our RIC team. Stay in tune with the fire, stay ready, stay deployable. And then the next people that come up as the backup team becomes that RIC team. So we're working with what we have. We can work with 13 when we're at full staff. With 2 off, we still have 11. I don't care how you look at it or which way you look at it, those 2 extra people make a huge difference. Even if we got 2 ambulances out, instead of having 5 back there, we're going to have 7 back there. It makes a big difference. We used to run with 8-person minimum staffing years ago because we always knew that we needed 8 people at least to effect a decent fire attack or a rescue. The call back to 5, it was being financially responsible. You know, we'll start the day at 9, but we'll call back to 5. And why do we do that? Because with a motor pump operator and an incident command, we still have a 3-man team that can go in and make a rescue or make an effective attack on a fire. And that's the very minimum. You know, we're still putting people at risk by 1710, but we've been operating like that for a long time. Right now, the whole idea of the 13 is it gets us closer to the NFPA 1710, 15 required. But the other thing it does is it gives us that backup when we do have these 2 ambulances or 4 ambulances. It's going to save money for the city by not having to call people back because we have that 2-person, I don't want to call it slush fund, but extra people than what we do now. So there's more than just the benefit of meeting 1710. There's a benefit for the city. Who it really benefits is the citizens and the members that we have because they're safer with that kind of staffing. That's where I got 13 or the 6. How long will that sustain? I can't tell you that. It depends upon, you know, right now we're 170 calls above last year, where we were last year at this time. That's a far cry from the year before because we were 15% higher the year before. We went from 3,970 calls to 4,600. I'm projecting right now we'll probably be right around 4,800, somewhere in there. Now anything can happen. We could get a lull or we could get an increase, and it could be 5,000. I don't know, but right now we're about 170 or so above where we were last year. So at this time in the year.
Yep. Tom or Dennis? Ryan? I just have a couple questions. You said on this sheet, when you have the calls, you said when apparatus is out, are some of these, it may be, for example, a car accident, that there's a fire truck and an ambulance, it might be one incident, but multiple pieces of equipment?
So each one of those numbers, the only time you'll see a double number is if we have a second ambulance. They'll go out and they get called and say, we got to have another ambulance. I'll tell you that our motor vehicle crashes in the city aren't that many in a year's time. We do not, that is not like one of those is an ambulance and one is a fire truck going to the same scene. We don't do that. Some people pad their numbers like that, but we don't. A call is a call. I don't care if we send a fire truck. When we go to a fire incident, and we send 2 engines and, an ambulance and a ladder truck, that's 1 incident.
Okay.
So that's 1 incident number.
Good. One more question is, and I'm sure we'll get to this when this comes to finance, but do we have any idea yet what the revenue is from these new contracts that we have, and what kind of rates we're seeing with this new collection company?
Tim was going to look at that. He's the expert for that.
Okay.
The only number that I've heard over the time was the one that I've shared with you, is that from our user fees, the projection and the increase and what's left from the contracts from adding that 11th tier, that last person in that 11th tier, is around 340,000 is the one number that I've heard. I do know for a fact that Medicare payments have gone up 40% from last year, so there should be an increase there. I do know that the act that Governor Evers signed goes in effect January 1, brings the Medicaid payments up to the Medicare payments, which is about 30% more, or more. It's more than that, because it brings them from about $170 up to where Medicare is, which is now is going to be around 400 and something. So that's a big increase, especially when you consider that our run volume, about 41% are Medicaid calls and about 42% are Medicare calls within our city. So, that should be a large increase in the income coming in from those.
So all total then, with Medicare and Medicaid, you're in the 80%? Okay.
And that's not one I ran, that was one that was run by LifeQuest. I asked them to run that report because I wanted to know what our population was, what was the makeup of our population, so.
And do we have enough experience yet with this company to know what kind of collection rates we're getting?
I think by now we should. We're 3 months in. I'm trying to understand it myself. I don't have Tim's experience in finances, but the charts they use with the money coming in is on a gradual increase. Last month it crested for the month over 100 and I think it was 114,000. So that's a pretty good income. I don't know what AMB was, but I would expect that's going to raise just because of those increases in payments. But again, Tim is the expert on that.
Got it. Patrick?
On this packet here, you had highlighted Group 17.
Yeah, I forgot. I'm glad you pointed that out. That one is kind of swayed. And as I went through there, I looked. I think what happened there is somebody forgot to hit a back in service time, and when the battalion chief was looking through it, the medic might have hit. It's easy to hit just the clock, and so that's a swayed number. That's one, but you take that one out of there, that's still plenty there. I mean, it's that's why I highlighted that. I wanted to remember. I must have gave you my packet. I wanted to remind you or show you that one was probably a false number. So,
Anybody have anything else? Ben? Brian? Nothing?
Thanks, Chief, and members of the HR committee, Ryan as well. Anybody else in the public? I guess I kind of came up here and wanted to put something together, kind of drive home this point more or less, but at the same time, kind of share some of my thoughts and perspective from a 16-year employee with the city of Wisconsin Rapids as a firefighter and paramedic and now a battalion chief. In studying and practicing public administration over the past decade, one of the tenets that's most important in that profession is service without fear or favor. Throughout the pursuit of this reducing liability through additional staffing for the Wisconsin Rapids Fire Department, I've really never been more challenged to fulfill that personal expectation of principle. It's been a pleasure to serve this community over the past 16 years, public safety professional. I've engaged and formed personal connections with citizens, patients, community leaders, families alike, as well as some of you on this board here. In an equal connective nature, I've also connected with the men and women that served beside me over these past years, and also take on a special role as my brothers and sisters within the profession, as they term it. In the result of these connections, both personally and community-based, it's really been a challenge to uphold that tenet, excluding fear or favor in my public administration. It's my knowledge of our public safety limitations rooted in staffing, of which drives my presence and passion to engage in your committee throughout this process. This is not fear for just my brothers and sisters within the fire service, but equally for the liability as we as city officials are placing indiscriminately throughout our community. Simply stated, this is not just a fire department problem or a city problem. This has really become a community issue impacting its safety. It's true I am guilty of favoring my community, those who I have connections with, also call this city of Wisconsin Rapids home as I do too. I'm also guilty of favoring these same men and women who serve beside me in an organization of which I began as a probationary firefighter, and now I serve as their immediate supervisor, placing me in the position to send my brothers and sisters frequently into harm's way with inadequate resources. I am shameful to say that fear does drive my public administration in this arena. Fear of someone in the community in need without an acceptable response from their fire department. Fear in the same way for my brothers and sisters. We as public safety administrators have shared a dangerous liability impacting your constituents, your community, your families, and even your neighbor. Together, we have collaborated with your community committee, developed a better understanding of the risks through some of the accumulated quantitative data points, as the chief has pointed out, and then through qualitative data points through some of these stories and incidences. Together, we have taken an equally shared responsibility, and together we have creatively secured appropriately funding through revenue sources and grant provisions. It is critical to the sustainability of safety of our department, the city, but most importantly, its community members, that will serve to limit the liability by supporting the additional staffing for this organization. I truly do thank you, and we as well at the fire department thank the Human Resource Committee over the years for the tireless support, but most importantly, we ask you to work with us in solving this dangerous public safety liability. I can answer any of the questions that you have, maybe from a supervisory role that I serve in. The chief has a lot of the data points and is able to kind of look at that bird's eye view, but on a daily basis. Chief goes home at night after his workday is done, and then we as supervisors and brothers and sisters are asked overnight to stay until the final alarm at 7 when we are faced with shift change. And at times, when you don't have that redundancy in staffing, you are asking a lot of our members and the community to place in risk. So if you guys have any open questions for me, I'd be more than happy to entertain them, and I thank you for letting me speak.
Ryan, do you have anything? Thank you, Ben.
Thanks, Jay.
Derek, you up next, or?
I guess I don't really have anything prepared like Ben, but I just want to reiterate like Ben stated, from being there, with our brothers and sisters, for the whole shift when the resources aren't there. And I can see the frustration on the younger members when they're, ambulance, fire, calls just coming in repeatedly. And my fear is that we're going to lose a lot of good firefighters, because they're just going to get overworked and they can go do lateral transfers now, like your nephew did to Wausau. We all know Wausau's adding staffing. And Chief Bartek would be happy to take a bunch of our guys and gals. So I just really want you guys to understand that we have excellent employees, and my fear is losing them if we don't make some changes for a safer workplace. So, any questions on that?
Okay, thank you.
Can I say one more thing?
Certainly.
I think to follow up what Derek said, what's important for you and everybody in the city to know is the members we have here want to stay here. I've talked to some of our younger members and asked why they didn't go on the last posting, and they said, because we're working on this, and we know there's maybe a bright future here. We like the people that we're working with. We like the atmosphere. We like working for the city. But like Derek said, if that's not going to happen, they're going to go work someplace else. So I just want to reinforce what Derek's saying, but also let you know that they like working here. They like the atmosphere. So it's up to us to, people don't leave jobs because they hate their job. They hate their bosses. They hate the administration. So I'm lucky. I'm new. They haven't really met me yet. I'm just kidding. No, I believe we got a great management staff, and I think that's the reason. It's not just me. It's the other people that are in position there, and that's why they want to stay here. So thanks.
Thank you. Committee discussion? Dennis?
Yeah, thank you. The only question I would have is there, with the list here that you gave us of the surrounding area fire departments, is there anything in here you could delegate that they could do some of these jobs that your younger ones are doing, or are you looking at time, or is there a reason you can't use that?
So that sheet I gave you there is the areas that we respond to. This is in those areas outside the city that is strictly EMS. Most of those are our contracted areas. So when you're looking at Town of Port Edwards, Village of Port Edwards, Town of Saratoga, Town of Cranmore, City of Nakusa, Village of Buren, those are all our contracted areas. We can't allocate that to anybody else. What we've done to try to lighten the load on those younger members is we've switched up roles. Used to be Med 1 went on probably 60 or 65% of the calls. We realized we were beating the heck out of our young people. These guys behind me collectively put their heads together and come up with a nice plan, and that was Med 2 is going to take care of the west side of the city and Port and Cranmore. Med 3 takes care of Saratoga and the city of Nakusa. Med 1 takes care of the city on the east side and Buren. They've taken that load off of that one ambulance and pretty much shared it. It's like a 40-30-30 split. The members have liked that. I think this is one of the reasons why they like to be here is they know we're working for them. They know we're trying to make, a bad situation as good as we can make it. I think that's one of the reasons. As far as those other ones, the mutual aids, Dennis, the ones, the big flats and stuff, those are our mutual aid partners. Again, those calls are, in a year's time, aren't even like 1% of what we get called to down there. So we can't really allocate that to anybody else, but we already have distributed the workload across the fold. I'll tell you right now that, so each person that actually goes and does patient care in a day gets ambulance duty. It's very seldom that all 9 people on shift don't get ambulance duty, because even the battalion chiefs go out on ambulance calls. Because when you get that 4th ambulance, somebody's going out. We explain that to you as 2 people on every ambulance, but you get a chest pain or difficulty breathing, that's 3 automatic. One of the things we've done to try to help that is we send, during the day, I don't even have a staff vehicle anymore. We give it up to the guys to use as a chase vehicle, so that once they stabilize the patient, they only need 2 to be able to take somebody to hospital. They can come back with that chase vehicle and get back in service quicker, so that we got more people available. We've done a lot of things over the years to try to get people back quick, and we're just at a point now where we can't do anymore. We're strapped, and we need those personnel. So that's a good question, but yeah, we can't allocate that to anybody else. I mean, when we got 4 ambulances out, we'll turn down that mutual aid. Absolutely. The citizens that we serve come first. And we've done that. We've actually, over the last year, because the mutual aid partners that they had couldn't have it, couldn't get into it, the people we've called couldn't get in. They only had enough people for 1 ambulance. We've had to put people in what we call a queue. We take our lowest priority patient, and they're going to have to wait till we get an ambulance back in service. It doesn't happen often, but it happens once in a while. And that's really a shame. We had 2 more people, that wouldn't have happened in each one of those instances. So, and the people were probably that are that is lift assists. I don't know if everybody knows it, but if a person lays on the ground, especially as you get older for long periods of time, they go into what's called rhabdomyolysis. And what happens is they start producing toxins that get filtered by their kidneys, and it plugs your kidneys up, and they go into renal failure. So just the idea of leaving somebody on the ground for a longer or extended period of time can be detrimental to somebody's health. So, we don't come here willy-nilly asking for things we don't need. We're truly looking out for the citizens, and I am the members of this department, because they are our best resource, so, good question.
I think that the safety is the top priority of any government. And having a population like we have that is aging, we definitely have to keep in mind the resources of the fire department and EMT staff. So I'm just going to make a motion that we approve the 6 new firefighter positions.
There's a motion and a second. I guess the only thing is that I would like to see, Patrick, is that after the first 3 years that we will apply for that grant for the third time. I would like that in the motion, if you don't mind. All right, there's a motion and a second. All those in favor, say aye. Aye.
Aye.
Nays? Ayes have it. Effective January 1st, I'm assuming, Chief, yes?
Yes.
Yep.
We just want to thank you for, for listening and collaborating, like Ben said. I'm pretty happy with how this went between your committee and us. You generally listened and listened to the data points we had, and I want to thank you for your time and your consideration.
You're welcome. All right. Item number 4, discussion regarding on-site fitness program. Brian?
So it has, we've talked about this for quite some time. Currently, we have Aspirus, our on-site fitness program. And we covered it last year through the budget, and it's basically just a rolling calendar. It just rolls over year after year with minimal increases. In talking during the contracts earlier in 2022, we found a potential, another provider, more of the landscape of physical fitness testing within the police department and the fire department. And now we would have to navigate between both parties, building a program that we had talked about putting together that everybody agrees upon. That said, I'm wondering if it's not in our best interest to reevaluate the proposal process at this point to see, if we want to have potentially 2 separate providers, one for doing police and fire for the physical fitness testing, or one just for on-site and physical fitness testing. I guess we've talked about it on and off for the last year or so. So I guess I'm just looking for your guidance or your suggestions on what you'd like to do. I don't think it's out of the question that we could have a couple different proposals in front of you, next month to see what we'd want to do for budgetary purposes. And like I said, I know it's, I think I worked with Derek on some of it, just in the discussion factor with Jay on putting a fitness program together. So if you want to give me direction on that, I'd be glad to take it, and we'll go from there.
Patrick?
Does this program reduce the cost of insurance or something? I think that there was some discussion on that it pretty much pays for itself, or it does pay for itself, or maybe even...
Absolutely. The current program definitely pays for itself. Actually, we save, I forget the numbers off the top of my head, but we save a lot of dollars, and I'm going to say in the thousands, by having an on-site administrator for fitness, okay? That goes without saying. That's a great point, and I'm glad you said that, because yes, there's definitely a cost savings to that from an insurance perspective. Because if they don't seek that care here, and they have to go then to their doctor, to their physical therapist, to their wherever, that's going to be then more costly on the insurance side, okay? Now I think what we're looking for is, in years prior, and I think Derek, maybe I hate to put you on the spot, but has worked previously in the fire department with a couple different providers on what they put together, and I think there was some renewed interest in that maybe possibly, and we're just looking to explore those avenues if we have two different providers, on-site and PD and fire, or if we just go with one conglomerate, in which case, you'd have to have, costing proposals to say, what each would cost, either overall or by department, and we'd be willing to put whatever in front of you to look at. I think we just kind of need, more definitive direction now that we've got the contracts, wrapped up.
You have a question? Otherwise, I'll add something. Maybe this will help. So I think the thing that we're looking at right now is we have an overall wellness program, correct? But we're looking at adding a fitness program specifically for fire and police. And I think, so we're going to be expanding this program, especially for those two departments. What we're looking at right now is a wellness thing. And I think the question, I don't mean to speak for Ryan, but I think the question Ryan is asking is, one provider possibly does just wellness, the other one possibly does both. Do we want to put this out and see what it's going to cost us, correct?
Correct, yeah. And I think, and it might not be a bad idea to have submission for proposals again, because it has been, I believe, a few years since we've gotten updated proposal. As I said at the beginning, it just kind of rolls over from year to year currently, with our current on-site provider, and it's good. I have no issues with it whatsoever. But in just doing due diligence, it might not be bad to, see what's out there, proposal-wise or cost-wise, and ability to, service all departments, including the PD and fire side.
So you're looking, when you do the proposals, are you going, because you're asking for two different things, are you going to have them propose two different things?
Sure, yep, I can ask them to break it out however you would prefer it, a total all-in-one and a total all-in-one, or separate it out. Absolutely, I can do that, and I believe, I'm sure both would be, I know one for sure is willing to come and present and answer questions if needed, and can have the proposals here. So if you would like to do it next month, I can get back with them following this meeting and plan to do so. Okay, thank you.
Tom, anything else? Dennis?
Yeah, just one question. Are you eventually going to open this up for all the employees, or just the ones that you mentioned here?
No, it currently is open for all employees.
The wellness part.
The wellness part, we currently have somebody on site. Now, the fitness testing essentially is what it is, and this is where any of the firefighters can basically come in, speak, be more of a subject matter expert, but providers will build a program that a firefighter, they do a CPAT test. You guys correct me when I'm wrong, but they do a CPAT test when they begin. But what do they do beyond that? How am I doing, Chief?
Yeah, you're spot on. So in order to get on the fire department, we have to have a CPAT test that's completed. Actually, in the union contract is annually they have to go through a fitness test. The prior, I don't know, what do you call them? Fitness trainer or whatever that was here actually worked with Derek and the former chief to put together that program as to what does that look like. It kind of assimilates the fire, it's not the CPAT, what's the other one? The one you see on TV, the competition, some of that, it kind of simulates that. So it's things like you got to crawl for so long with an SCBA on. You got to climb, I think 3 or 4 stories of flight. You got to walk a half a mile or a mile, so it's things like that. It's raise a ladder, climb a ladder. It's things that assimilate to the job that they're performing. So we were doing that every single year with the former, and then obviously COVID hit, so we weren't doing it with the Ascension one now because they didn't want to get in those close quarters. So, but that actually is part of our contract. I don't know if it is with the police also. So.
Well, the only other question, are you trying to gear this kind of like what the county has for their employees, or it sounds like it's a little different than what they offer?
Yeah, I'm not sure what the county, I'm not sure what the county offers. I just, like I said, I know we have the on-site person here currently, and we're looking to have a bit more emphasis on the police and fire side just due to their physical requirements, during their jobs. Or, if somebody is to get hurt and they're working on coming back, with a bad knee or something. I think there's got to be a standard that can be set to say, like Chief Eckes just mentioned, they got to be able to maybe crawl so far. And if the person can't crawl so far and they can't come back to work, we'll have a program in place that would say, but if you work on doing these things this many times a week, basically a little bit of physical therapy in-house, then you will be able to come back to work. So they go through the specific, job-specific program, either built for PD or built for fire, and they could then get back to the job or, do it safely.
Okay, thank you.
Does that make sense? Okay, thank you.
So, anybody have anything else? You understand what we're looking for? Very good. Anybody else have anything? All right, that doesn't require any action now, so I guess before we get to item number 5, should we schedule a meeting for next month? We can and we should. October 11th at 1:30? Got it? All right, I guess with that, we'll move on to item number 5, adjournment. There's a motion for adjournment. Is there a second? Motion and a second. All those in favor say aye. Aye. Ayes have it. Meeting adjourned at 2:18. Thank you.